A very good afternoon to everyone. Myself, Dr. Grishma Gupta. I've completed my MDS in Conservative Dentistry and Endodontics. I'm live today from the beautiful city of Gwalior, which is situated in Madhya Pradesh. And my topic for presentation, in fact, I would say my topic for discussion today is secrets to successful rubber dam placement. I'm going to present my topic today under the following headings. First of all, the introduction and the history and evolution of the rubber dam. Then after, the various armamentarium which are used in rubber dam application. Then after, the various types and the parts of the rubber dam clamps. Then after, two different application methods of rubber dam placement. Tips and hacks for clamp application in difficult situations. And finally, conclusion and a Thanksgiving note. In the present scenario of the increasing cases of COVID-19, dentists are at the maximum risk of contacting this infection. In the operatory, aerosol production is shown in the center of this picture as you all can see. If dentist comes in direct contact with these aerosols, they become infected, and if these aerosols spread in the surrounding atmosphere, they can affect susceptible individuals. If a patient enters into our OPD and if he or she is coughing or sneezing, then this can result in contaminated surfaces. And by touching these surfaces barehanded, dentists can even catch infection. So we can infer that if we can control aerosol production at the site of production only itself, then this vicious cycle of spread of infection can be checked, and Rubberdam proves to be the biggest help in this. Now, there are few studies which prove that apart from the cross infection which is spread because of the aerosol production between the dentist and the patient, why the usage of rubber dam is important for both endo, restorative, and prosthetic work. Lin in 2014 proved that the survival probability for the teeth whose root canal treatment was performed using a rubber dam was 20.3%, and on the contrary, the success rate was only 88.8% when no rubber dam was used. Wayne Neuhuisen in 1994 evaluated 612 teeth whose initial root canal treatment had failed and they were retreated, and the success rate was significantly better for those cases where isolation with rubber dam was used. Abbott in 1994 evaluated 100 patients to determine that what factors were most associated with continued pain after the initiation of root canal treatment, and lack of use of rubber dam was the number one factor in that. Now, why this thing happened that there is continued pain after the initiation of root canal treatment? Because there is a change in the environment or the microflora of the root canal when you have done the access opening and you have opened it to the outside environment. If contamination with saliva occur at this stage, then new microflora will get introduced into the root canal, and this may result in flare-ups or continuous endodontic pain even after completion of treatment. Now, the various milestones reached in the evolution and usage of dental dam. In the year 1836, Rich used a gold band that is placed around the tooth for isolation. This was described as coffer dam method, and we can say that it was a prototype of present day's rubber dam. 1864, it has been used in dentistry since this year. Sanford Christie Barnum came up with the idea of using a punch sheet of rubber and pulling it over the treated tooth. In 1882, White developed the cofferdam punch. In 1990, the interest for rubberdam was reborn, and the use of rubberdam unfortunately is still not routine-like. And in 1920, with the product promotion of silver amalgam and the development of suction methods, the demand for the rubberdam technique declined. But in present-day scenario, when the use of composite has been increased worldwide, the importance and the interest in the rubberdam usage has increased again. Now we'll talk about the various armamentarium which are used in rubber dam application, and the first one is dental dam or the rubber dam sheets. There are many classification of these rubber dam sheets, and we'll go through them one by one. The first one is they can be either powdered or powder free. They can be scented or can be plain. They can be flavored like mint or peppermint flavored or non-flavored, and they usually come in two sizes, that is 5 into 5 inches and 6 into 6 inches. The right hand side two pictures shows two more classifications of rubber dam sheets. The first one shows textured and non-textured sheets. Textured sheets are better when you are interested in dental photography or if you want to publish a case in any article. The second picture shows the other classification, that is latex and latex free rubber dam sheets. Latex-free rubber dam sheets are better for people who have proven latex allergy. Then on the basis of thickness of the rubber dam sheet, these can again be classified as thin, medium, heavy, extra heavy, and special heavy. Thin sheets are good for endodontic isolations. Medium thickness sheets are the most often used sheets as they are easy to manipulate. Heavy ones are recommended for restorative procedure as it aids in the retraction of soft tissues. Extra heavy affords maximum tissue retraction, and the special heavy are used for spatial isolation where tissue protection is paramount, for example, the bleaching procedures. Now the next one in rubber dam armamentarium is the rubber dam frames. The first picture shows some of the metal frames. The first one is metal regular. The second one is metal button. Metal button aids in the tucking of the rubber dam sheet onto the buttons which are provided into the frame. The next one is the contoured pedo frame, in which the lower border is convex so that it takes the contour of the face. The same is available as contoured adult frame too, and the next one is made up of nylon. The second picture or the lower picture shows the young frames and the Nygaard Osby frames in plastic material. The third picture shows a green color frame. This is a very interesting frame. This is an articulated frame. This frame can be easily folded over on its own, so that easily space is being created where you can place your X-ray films or your sensors, or you can even administer local anesthesia again if you need to do that. So no need to remove the complete assembly and the frame so as to carry on your next work. The fourth picture shows the T frame or the safety frame. This safety frame, what it does, the upper and lower, both these borders, they get locked into each other so that the frame get locked into this complete frame, and there is no need to tuck these rubber dam sheet again and again into the corners of the rubber dam frame. So it doesn't come out of the frame easily, and it's quite easy to work with them. Now the next one in armamentarium is the dental dam template. The first picture shows the dental dam template, which is usually available with most of the rubber dam kits and with the rubber dam kit, which is made available by Coltene too. The second picture shows the dental dam stamp. This stamp is very similar to the stamp and seal which are available for office work. So you can put this stamp into the seal, and then after you can put it over the rubber dam sheet. You will get the imprint of all the holes of or all the tooth there, and then after you may punch the hole accordingly. The third picture shows a very important point, which is that the perforation should be placed approximately 5 millimeter apart from each other. The perforation should not be made either too close to each other or too far apart from each other. Reason behind, if they are too close to each other, then tearing of rubber dam sheet may occur when you are applying it over the tooth, and leakage will obviously result. If these holes are made far apart from each other, then creases of rubber dam sheet will get accumulated in between teeth, and you will get very less room to do work, especially on the proximal areas. The next picture shows another a point which is a contraindication to the point which I just now explained, that the perforation should be 5 millimeter apart. The perforations can be made apart from each other more than this if any edentulous area is present in between two teeth. Yes, then you can break this rule and you can make the perforations far from each other. Now the next one is dental dam punch and forceps. The first picture shows the dental dam punch, and the pointed end is known as a stylus, which is used to make the holes. The second picture shows the importance of properly cut or properly round perforations to be made, because if the perforations are not perfectly round, or if they are elongated from any one side, that there are chances that the tearing of the rubber dam sheet may occur, or leakage may occur from that area when you apply that onto the tooth. The third picture shows the various holes and their corresponding teeth. The first hole, or the smallest hole, that is meant for the mandibular interiors. The second one is meant for maxillary interiors. The third one for premolars. The next one for molars, and the largest one is for the molar, which is supposed to be clamped. And the very next picture, or the fourth picture, that shows the rubber dam forceps. These forceps are required for placing the rubber dam clamps from the organizer onto the tooth. Now next we will talk about the rubber dam clamps. Please focus on the picture number 1 so that we can understand or we can learn about the various parts of a rubber dam clamp. The first one are the rubber dam clamp wings, which are lingual and buccal. The next one we have is the clamp bow, the two number, that is clamp bow. Whenever you are placing a rubber dam clamp over a tooth, always remember that the bow is always placed distally. It is never placed mesially because that will interfere with your vision and with your air rotor and other instruments too. The next one, the third one, is the clamp beaks. The next one, that is fourth, is the contact points. There are four contact points which can be seen on any of the rubber dam clamps, and whenever you are applying clamp over a tooth, 4 point contact is a must which should be there. Otherwise, the clamp will rock over the tooth and you won't get that much of retention which is actually needed. The fifth one, or the fifth point, is the notch, and the sixth one is the clamp holes. These clamp holes are required for tying a floss, and I'll later explain that why a floss is needed when you are applying a clamp. The next type of rubber dam clamp are the winged and the wingless ones. The third one are the blend and the retentive clamps in the lower picture. Now the difference between the blend and retentive clamps is that, as you can see, that the jaws of the retentive clamps are more apically placed. This is done so as to make it more retentive. The next picture, the blue ones, these are the winged clamps. The upper one are for the premolars and the lower one are for the molars. Now, continuing with the rubber dam clamps, next we will talk about the wingless clamps. The blue color pictures, both upper and lower, are the wingless clamps. The upper one are for the anterior teeth and the lower one are for the premolars and molars. On the right hand side, you're able to see a very big size clamp, which is a clamp with long guard extension. Now, this is a clamp, but this is not used with a rubber dam assembly. This one is having a very long guard extension, as the name itself signifies. This is used for the retraction of tongue and retraction of cheek at the same time. And you can put cotton rows for isolation also, and this clamp will be able to keep those cotton rows there for long time. So it is good for isolation, but it is not used with the rubber dam armamentarium. The lower one is a tiger clamp. As you can see that the jaws here are serrated. Now these are serrated for extra retention. Now extra retention can be needed on teeth which are severely broken down, and sometimes these are also needed on deciduous teeth too. Now the next type of clamps are the SG clamp or the Silker-Glickman clamp. These clamps are used in the posterior area, and these are used for severely broken down teeth, and a retraction of dam around the broken teeth can be done with the help of these clamps because these are having very long extensions. The next one in the series are the Holler clamps. These Holler clamps are the specially designed clamps which are used to retract tongue and cheek while eliminating moisture at the same time. Suction tube can be attached to the clamp, freeing up hands and making a more comfortable experience for patients. The next one, or the blue colored clamp, is the molar distal axis clamp. Now we can use this unique clamp when a tooth distal to the molar we are working on is missing and the lesion extends apically. The unique bow design allows for easy access of the handpiece and burr to the distal cavity. This clamp is made up of tempered steel with a blue plasma titanium coating. Now next comes the super clamp. Now again I would like to tell you that this super clamp is not used with the usual or the regular rubber dam assembly. This super clamp is having a pre-cut rubber dam material which is designed to fit the clamp. This clamp can be used only in the posterior regions and cannot be used in the anterior regions. You can easily place cotton roll around these clamps, and you can easily place your high volume evacuator also around these rubber dam clamps, and they retract the tongue and cheek at the same time. The next one are the brinker clamps. A set of 6 brinker clamps are available there in the market from B1 to B6. B1 is used for lower deciduous molars, B2 and B3 for upper deciduous molars, B4 are used for cervical caries lesions and for additional retention in structurally compromised teeth. B5 are used for class 5 lesions, and B6 are used for class 5 lesions on the incisors and canines. And as you all can appreciate that one bow is more wider as compared to the other one when we talk about these brinker clamps, and the wider bow is always towards the buccal side. Now next come the super clamp. Now again I would like to tell you that this super clamp is not used with the usual or the regular rubber dam assembly. This super clamp is having a pre-cut rubber dam material which is designed to fit the clamp. This clamp can be used only in the posterior regions and cannot be used in the anterior regions. You can easily place cotton roll around these clamps, and you can easily place your high volume evacuator also around these rubber dam clamps, and they retract the tongue and cheek at the same time. The next one are the brinker clamps. A set of 6 brinker clamps are available there in the market from B1 to B6. B1 is used for lower deciduous molars, B2 and B3 for upper deciduous molars. B4 are used for cervical caries lesions and for additional retention in structurally compromised teeth. B5 are used for class 5 lesions, and B6 are used for class 5 lesions on the incisors and canines. And as you all can appreciate that one bow is more wider as compared to the other one when we talk about these brinker clamps, and the wider blow is always towards the buccal side. Now, continuing with the same application method, the first picture shows that the forces which we applied into the clamp, that clamp along with the rubber dam frame and rubber dam sheet has been placed onto the tooth which was supposed to be clamped. The very next picture shows that how the clamp tooth appears. The third picture that shows that a blunt-ended instrument is being used so as to free the wings of the winged clamp of the rubber dam sheet so that the rubber dam sheet doesn't get teared up. The fourth picture from starting that will show you that how the clamp and the tooth appear when you have freed the wings from the rubber dam sheet. The very next picture or the fifth picture that shows that we have put it or we have pulled down the rubber dam sheet over the next few perforations which we made. The very next picture shows the use of a dental floss. A dental floss is passed through the proximal areas or proximal contacts so that the rubber dam sheet can easily pull down through these contact areas up to the cervical margin. And the very last picture on the right hand side that shows that how a clamp tooth appear, and we have completed the rubber dam application method in which the whole assembly has been created outside the mouth and then after it has been put onto the tooth. Now the second way of applying rubber dam is to apply the rubber dam clamp first on the tooth and then after applying the rubber dam sheet and the frame. But please note that this method is better when you are using wingless clamps because there are less chances of the tearing of the rubber dam sheet when you are using this kind of application method. So the very first picture shows that the tooth which was supposed to be clamped, the clamp has been placed on the tooth. Always remember that the bow should be placed distally, and always there should be a 4-point contact when you are putting a clamp over a tooth. The second picture shows that the rubber dam sheet has been stretched over the bow of the rubber dam clamp, and the third picture shows that how a rubber dam sheet come down over the rubber dam clamp and the sheet has been passed through the rest of the perforations or through the rest of the teeth too. Now next we will talk about the various tips and hacks which can be used while doing the rubber dam application and if we get stuck at some or the other point. Now, nothing could be more disheartening for a dentist to see the condition of a clamp, which has been shown here in the figure number 1, that is the fracture of clamp, and that can occur accidentally. If you open the clamp more than the limit or the stretching limit of the clamp, that it may break and it may become an aspiration risk. So these clamps can fracture over time with wear and tear, and this most commonly occur at the bow of the clamp. To avoid a fracture clamp becoming an aspiration risk, it is recommended to ligate floss through one hole around the bow and through the opposing hole in the clamp. Now, the next step is for restoring the more cervically placed caries or subgingival caries. As we can see in the very first picture, that the bows which are available, which are there in the already available clamps, these bows are at the same level. So when the cervically placed caries we have to treat, on the buccal side you may see that, or on the labial side you may see that the caries are more gingivally placed as compared to the lingual or the palatal side. So what to do for these kind of cases? So as we can see that in the second picture, what we have done, that we have exposed the clamp jaws to the flame. Okay, we want to soften them up. We are basically modifying this clamp according to our own needs. Just after exposing the clamp jaws to the flame, we have immersed it into water. Then after modifications on the clamp are made using two flat pliers to bend the facial jaw more apically. All right, we have again heated up onto the Bunsen burner flame, and we have again immersed that into oil. And in the last picture, you can see that the buckle bow is more apically placed. So it is definitely going to be useful when you want to treat subgingival caries. Now the next step is for placing the retainer and the clamp together. This usually happen when you have to treat proximal caries or MOD cavities or buccal or lingual extensions. So as we can see in the first picture that this is the initial situation where you have already applied the rubber dam clamp and the complete rubber dam assembly. Now the second picture that shows that how you're going to place your retainer when you have your rubber dam already in place. So what you have to do now, this usually happen in 400 dentistry. You need the help of your dental assistant here, and you have to train him or her also in the same. So what we want the help of our dental assistant to hold the rubber dam and open the clamp a little bit with the rubber dam clamp forceps, so that we can insert the matrix band inside the rubber dam clamp. In the final picture, you can see that the rubber dam matrix band has been easily being placed in between the tooth and the rubber dam clamp, and we can restore the cavity quite easily here. Now, next tip is regarding a severely broken down teeth. As we can see, and we have already seen this usually, that if a tooth is severely broken down, then it will become impossible for us to apply rubber dam over the same because clamps cannot retain anywhere. As we can see in the first or the upper picture, this is a severely broken down maxillary central incisor. So, what was being done, to composite beads were placed on the labial and the lingual side that become areas where the clamp can be retained easily. And the second or the lower picture that shows a severely broken down molar in which two walls were missing. So a composite pre-endo buildup was done, or a composite lip was made, which help in retaining the rubber dam clamp over its place. Next, we'll talk about another situation, which is working without clamps or the minimum number of clamps. The very first picture shows you that the molar has been clamped over here, and the anterior teeth, they have been separated from rest of the area with the help of a very small piece of rubber dam sheet. So this can be used if you cannot use multiple clamps in an area due to any of the reasons. The second picture or the lower picture shows yellow color bead-like things in between the teeth, and these small things are known as wedgets. These wedgets are exclusively made available by Coltene only. We'll talk about these wedgets in detail later on. The third picture shows you elastic ligatures. These elastic ligatures can be used or they can be placed around the tooth with the help of the rubber dam forceps. These elastic ligatures work like clamps only, but not in many conditions, especially when extra retention is needed, then you have to apply a clamp. Uh, there, these elastic ligatures are not going to work. But if you have to do some endodontic work, or if the tooth is not very severely broken down, then you can easily use this elastic ligatures along with the rubber dam armamentarium and without using rubber dam clamps. Now these are the wedgets, and these wedgets are available in both latex and non-latex composition, and these wedgets are available either as large or small size, and they can be used in many of the critical situations which I have shown you just now. Split dam technique. As we are able to see in the picture number 1 and 2 that we have not punched any individual holes for individual teeth. Rather than that, we have punched a single hole which was able to accumulate 2 or 3 teeth at a time, or a complete 16 at a time. This thing has to be worked when you have to work on multiple teeth in a quadrant, or on teeth that require either subgingival or paragingival preparations. As we are able to see in the third number picture also, that there is extraction site which is very immediate to the tooth which has to be treated. So this is an example which shows us two advantages of rubber dam. First one is that the extraction site can be easily protected from the dental procedures because of the presence of the rubber dam. And second thing, split dam technique can be used here. One more picture is here which is showing us the use of liquid dam. Liquid dam is a flowable material which can be easily cured, and it is used so as to prevent the leakage which occur around the tooth which has been rubber dam clamped, or which is having a rubber dam sheet over it. Now the question arises that how many teeth should be isolated when you're doing a particular work. A single tooth should be isolated when you're doing endodontic treatment or you're treating a class 1 cavity. Three or more teeth should be isolated when you're working on class 2 cavity or on MOD cavities. one should mesial and one tooth distal should be isolated for this particular case. Whole quadrant should be isolated when you are preparing a case for case presentation or publication. And the very right hand side picture shows the frontal area. In case of frontal area, if you're treating any of the anterior tooth, it is always advised to isolate the complete frontal region. Now, how to check the contact areas and the clamp stability while we are applying a rubber dam clamp over a tooth. The very first picture shows that always use a dental floss to check the nature of the contacts to avoid tearing of the rubber dam sheet. Sometimes the contact areas of the teeth are quite tight and it becomes difficult for us to pass rubber dam sheet through the same. So if we determine the contact areas or how tight the contact areas are, if we are able to determine this previously, then we can easily use any of the separation methods to separate the teeth so that we can easily pass on the rubber dam sheet through the contact areas without tearing the sheet. The second picture shows that the size of the clamp should always match the size or the buccolingual and the buccolingual dimension of the tooth. These three pictures shows that what should be the correct size of a clamp which we should use for a tooth. The first picture shows that one of the clamp which is used here is quite large. If it is quite large, then it is not going to be stable over the tooth and it is going to rock over the tooth when you are doing any procedure. If it is quite small, then there are fair chances that leakage will occur when you are doing a procedure. And if the clamp is of correct size, then no doubt there will be no leakage and no rocking of the clamp will take place. How to prevent dental dam frame interference with RVG sensor placement? Whenever we are using a rubber dam sheet, we use the template to mark the places where the holes have to be punched. If we feel that there is a problem with the placement of RVG sensor, then one thing which we can do is that the opening or the holes which we punch in the rubber dam sheet, we can make it either more or less within the center of the dam, which is asymmetrical with respect to the patient's face. In this way, as you're able to see in the second picture, we get clear room and a large area from where we can easily place our RVG sensors. Inversion, a very important term when we are talking about rubber dam placement. The first diagrammatic representation shows a blue line. This blue line is the rubber dam sheet. So in the picture A, you can see that if there is not complete inversion or the complete tucking of the rubber dam sheet inside the cervical area of the gingiva, then easily the saliva and the GCF can come out of this area and can ruin your restorative material which you're using on your tooth. So this blue line or this rubber dam sheet should always be tucked very neatly and cleanly inside the gingival crevice. This is known as inversion. The right hand side picture shows four pictures which are showing the incomplete inversion of the dental dam. If the dental dam is not completely inverted, then maybe the cervical portion of tooth will not be exposed much, so that will create problem with your procedures, or maybe leakage can occur, or maybe tearing of dental dam material may occur. So many problems are there, so it is important to invert the rubber dam, and there are many procedures by which we can do the inversion of rubber dam, and we will discuss them one by one. Now there are four levels of inversion which have been discussed over here. The level one is the air inversion. In air inversion, we use the three-way syringe, and with the very short blows of air, we try to tuck the rubber dam sheet inside the gingival crevice. As soon as we are blowing air with the help of three-way syringe, with the help of a blunt end instrument, we try to tuck the rubber dam sheet inside the gingival crevice. Level 2 is inversion with the help of a dental floss. We can use a dental floss and we can pass it through the contact areas just as we passed it through the contact areas initially before applying the rubber dam when we were checking the proximal contact areas. So when we pass on this dental floss through the proximal contact areas, the rubber dam sheet is also passed through the contact areas up to the gingival crevice along with this dental floss. Now the level 3 is inversion with knot ligatures. This technique provides two main advantages. One is that the floss pushes the rubber deep into the sulcus just similar to as we saw in the level 2. And secondly, the floss tightens around the tooth and holds the rubber dam in place during the restorative procedure, which is very clear from the lower or the second picture. The next level is level 4, which uses Teflon tape for inversion. Teflon tape or the plumber's tape is very good in this procedure, and it is holding a very good position nowadays in restorative dentistry. So when you're using this Teflon tape, it pushes the rubber dam sheet deep into the gingival crevice and help in inversion of rubber dam sheet. So next we will talk about the various type of clamps which are available by Coltene. The first one is the 9 clamp set. That is a beginner clamp set which is having very limited number of clamps, so it is quite easier for us to use them. The second one is the Fiesta color coded clamps. As the name itself indicates that these are the color coded clamps, so it is quite easy to use them, along with a user's guide available. A very important and specific feature of these clamp set or clamp kit is that it is having an autoclavable organizer available with it. So you can easily keep your clamps over the autoclavable organizer and sterilize them without the fear of losing them. The third kind of clamps which are available by Coltene are the Tiger clamps. These are the serrated clamps. The advantages of the same I have already enumerated in the previous slides, and these are quite useful for grossly decayed teeth. The last ones are the brinker clamps or the showstoppers by Coltene, because these clamps are available only by Coltene, and the advantages and the uses of each and every brinker clamp I have already enumerated in the previous slides. Now, the next product which is made available by Coltene is the hygienic framed non-latex flexidam. It is having many advantages, like first of all, the rubber dam sheet and the frame assembly is all together, so no need to attach frame over the rubber dam sheet. You just have to punch a hole directly into the rubber dam sheet and place it onto the tooth along with the clamp. It does not need to be sterilized after use and allows for maximum flexibility and increased patient comfort. The rubber dam frame which you are able to see over here is quite flexible, so it is easy for you to place your X-ray film or your RBG sensor, or if you want to administer local anesthesia again, you can do this quite easily. Now, next we will talk about the various kind of hygienic dental dam kits which are available worldwide. Four kind of kits are available. The first one is the winged complete kit. It consists of the winged Fiesta color coded clamps. Along with that, rubber dam forceps, rubber dam punch, wedgets, rubber dam template, medium thickness rubber dam sheets, and frame are available. The second one is the winged standard kit without patch and forceps. So it is having all the components which I have mentioned just now, except for the punch and forceps. The third one is the wingless complete kit. The only difference between this kit and the first one, the complete kit, which I explained, is that this kit is having all the wingless clamps in it, and not the winged clamps. And the last one is the simple dam kit or the beginner's kit, which is having all the components which I've enumerated in the first category, except for the presence of only four clamps, so as to make it more easier and simple to use. These four clamps are, one is used for the upper left molars, the other one is used for upper right molars, and lower left and lower right molars. The one is for interiors and one clamp is for premolars. Now, next we will talk about the Coltene dental dam sheets. The first one are the Roico Elastic Dam, which are available in standard and children's size. The specific characteristic is the elasticity of these dental dam sheets. These are quite elastic and can be easily manipulated around the teeth. The next one in the series is Roico Dental Dam. The difference being these are tough and comparatively less elastic, so a lot of retraction is available when we are using these dental dam sheets. The next one are the Roico FlexiDam sheet. The difference between FlexiDam and ElastiDam is that FlexiDam is non-latex material, so it is very good for the non-latex allergy people. The last one are the standard dental dam sheets, which are made available by Hygienic. They are available both as latex and non-latex, and they are available in standard and children's size too. So that was all from my side for today's discussion. I would like to conclude today's discussion by saying that rubber dam application is still evolving or in budding stage in India. We all colleagues have to try our level best to help each other in understanding and using the rubber dam application. Believe me, once you start using rubber dam in your practice, then you will never ever think of doing any next case without a rubber dam application. General dentists and even many of the specialists think that, oh, rubber dam application is quite cumbersome, it's time taking, it's technique sensitive. Until and unless you don't do anything, you will find it cumbersome only. So at least start using rubber dam in your practice. Apply rubber dam at least once a day, or at least once in any three or every 3 4 days, and slowly you will get the habit of using rubber dam. this is not only beneficial for you but also for the patient also, because when the patient see that the dentist is caring so much for the patient, they feel safe in your hands, and that instill another level of trust in patients for their dentist. And I would also like to thank team Coltene for giving me this wonderful chance of sharing my views and my ideas with all of you. If you people have any queries or any doubts regarding rubberdam application, then you can freely contact me, and you may post your queries here in the WhatsApp group. So thank you so much. So that was all from my side for today's discussion. I would like to conclude today's discussion by saying that rubberdam application is still evolving or in budding stage in India. We all colleagues have to try our level best to help each other in understanding and using the rubberdam application. Believe me, once you start using rubberdam in your practice, then you will never ever think of doing any next case without a rubberdam application. General dentists and even many of the specialists think that, oh, rubberdam application is quite cumbersome, it's time taking, it's technique sensitive. Until and unless you don't do anything, you will find it cumbersome only. So at least start using rubberdam in your practice. Apply rubberdam at least once a day, or at least once in any three or every 3 4 days, and slowly you will get the habit of using rubber dam. This is not only beneficial for you but also for the patient also, because when the patient see that the dentist is caring so much for the patient, they feel safe in your hands, and that instill another level of trust in patients for their dentist. And I would also like to thank team Coltene for giving me this wonderful chance of sharing my views and my ideas with all of you. If you people have any queries or any doubts regarding rubberdam application, then you can freely contact me, and you may post your queries here in the WhatsApp group. So thank you so much.